Good morning, or good afternoon rather, everyone, and welcome to today's webinar presented by PracticeHub, Accreditation, Kickstarting Your Accreditation Journey. Thank you so much for attending. We really appreciate it. We do have both PracticeHub clients and non-PracticeHub clients in the audience today, but the information is really valuable and relevant to everyone. So in terms of the speakers that we have a great panel of guest speakers lined up. Laura Mucci, who is an accredited surveyor. We have Carmel, who is a seasoned practice manager. And then we also have Anna Maria, who is our senior product person at PracticeHub, and Maya Ajdukovic, who is our senior business development manager at PracticeHub as well. So without further ado, I will hand over to them and we'll get started. Thank you.
Thank you, Persephone. This is an overview of what we'll be covering in today's webinar. The quality practice, it is more than just accreditation. We will hear from our accreditation surveyor, Laura, who will speak about the key differences between the 4th and the 5th edition of the RACGP Standards. She will also talk to you about preparing for Accreditation Day and beyond, providing you with tips to assist you and your practice team. We will then hear from Carmel, who has been using PracticeHub for a long time, about how she uses PracticeHub for successful accreditation and has done so for several cycles now. And finally, we will provide you with a demonstration of our new platform, PracticeHub, and that will be done by Anna Maria. So just to talk about the difference between accreditation and quality practice. This comes in response to questions from you who are not GP practices, asking us whether you will get value out of this webinar. We certainly think you will, because many of the aspects of the RACGP standards apply to any type of medical practice. These include privacy and confidentiality, telephone and electronic communication with patients, information security, medication management, culturally appropriate care, and presence of a third party during a consult. I will now hand over to Laura, who will start to talk about the key differences between the 5th and the 4th edition of RACGP Standards. And a little bit about Laura. Laura is an accreditation surveyor. She also works for Country SAPHN as a General Health Council Clinical Council member. And she has attained a Bachelor of Social Work and Diploma in Children's Services and several certificates in health administration. She's been working in general practice since 2007 and has extensive management experience across a diverse sector, including healthcare, early childhood and telecommunications. Over to you, Laura.
Oh, excellent. Thank you, Maya. That makes me sound very impressive. Thank you so much. So as you can see on the slide there, in 2013, the RACGP reviewed the definition of a general practice for the purposes of accreditation. So as a result, 3 core criteria were outlined, and these criteria were required to be met for a general practice or a health service to be accredited against the standards. So as you can see there, you must be able to operate within a practice model as defined by the RACGP. The health service must be predominantly of a general practice nature, and the practice must be capable of meeting all of the mandatory indicators. So if you'd like your service to be accredited against the standards, it actually must be formally assessed by an accrediting agency that has been approved by the National General Practice Accreditation Scheme. So it's worth noting, though, that the RACGP actually supports accreditation as a voluntary scheme. So if you'd actually like some information about how your service may fit into this criteria, if you don't actually part of the scheme, feel free to reach out to the RACGP, or you can actually reach out to an accrediting agency. So next slide, please. Before we have a look at outlining the key differences between the 4th and the 5th edition, it's actually worth highlighting the purpose of the standards. So the RACGP developed these standards to protect patients from harm by improving the quality and safety of health services. So in this way, the standards actually provide a benchmark for quality care and risk management in Australian general practices. So I actually like to keep this at the forefront of my mind in my current work, but also when I go out and survey practices. And so if we look at what we do through this lens, it actually makes it easier for us to make decisions around the changes that we'd like to implement. And it's also important to note here that the standards are actually minimum standards. So this means that we're encouraged not only to meet the standards, but also continually improve the way we deliver care. So what this does is it actually lends itself to looking at the accreditation process as a journey. So it's a process rather than an end product, but we'll talk more about that later. So unlike the 4th edition standards that actually had 5 sections, the 5th edition standards have been developed using a modular format that's comprised of 3 areas. And you can see that in the pie diagram above. So the number 1 is the core module, the second is the quality improvement module, and the third is the general practice module. So the core module actually has 8 standards, the quality improvement module has 3 standards, and the general practice module has 6 standards. I want to try and explain this without confusing you, so just bear with me here. So when you're reading the standards, you'll see a C for core, a QI for quality improvement, and a GP for general practice. And then it's followed by some numbering that indicates the standard and then the criterion. So just for an example, C1.1 refers to core standard 1, criterion 1. And then it gets broken down a little bit further into indicators. And this is where you'll see a letter next to the standard and the criterion. So if we use the example that I've just mentioned, C1.1a, that relates to core standard 1, so that's communication and patient participation, and then criterion 1, which is information about your practice, and then indicator A, which states that our patients can have access up-to-date information about the practice. So it's actually worth noting here, when you are reading the standards, you will see generally a black triangle next to that indicator. And what that does is that indicates that it's a mandatory indicator. So it means that your practice has to actually demonstrate this to meet that. And then when you'll see others without the triangle, they are not mandatory, they're aspirational, but the RACGP does encourage you to meet these indicators, although they're not actually essential for you to meet your accreditation status. So this new format provides a mechanism for the standards to be adapted to suit other healthcare settings as well. So for example, the core and the quality improvement manual will apply to all healthcare settings, but then there's an opportunity to remove the general practice section and then replace that with another set of standards, for example, for correctional services or immigration and detention centres. So hopefully that explained how to read the standards. If you're unfamiliar with the sequence I've described above, I'm sure once you start referring to the standards, it won't take long for you to become familiar with the new format. So next slide, please. Prior to the 5th edition, the standards dictated how your practice was required to meet a standard. So it was very prescriptive. The 5th edition standards actually encourage us to think about them in terms of outcomes. And it's also important to have a think about what the intent is. So what is that standard asking us? So underpinning all of this is a mindset shift. And the great thing about this is that your practice can actually choose how you meet the standards, remembering, of course, that each clinic is different. So this gives practices more opportunities to really think about your patient cohort and develop systems and processes that align with the way the practice delivers care. So in turn, what this does is it makes the accreditation process much more meaningful. So rather than responding to the indicators of things that actually need to be in place, there's a range of opportunities to develop compliance in a way that actually makes sense to your clinic. This is also a good time to highlight the difference between must and could. So when you are going through and having a look at the standards, you'll see some explanatory notes, and they're actually a really good resource to have a look at. And what that does is that we will highlight what must actually be done, and then it has a could reference as well. So the must equates to mandatory and a could is optional. So an example here, if we think about the other standard that we just looked at before, you must make practice information available, and you must actually make sure that you update that practice information if there are any changes. But as for how you do this, it's actually up to your clinic team. So some examples that you might already have in place would be the practice information sheet. Some people may choose to provide this information on a website instead. They might be in a cohort where people are using the website and not really interested in paper. So there's a range of different ways to meet this standard. And again, the intent here is basically to provide current information about the practice, but how it's done is actually not prescribed as it was in previous standards. So now we can have a look at some of the new criteria, and you can see on the slide there, these first 5 are under the core module. So I'll go through these briefly and hopefully some of this information will be useful for you. So if we have a look at the first one, this is with regards to ethical dilemmas, and this relates to the second core standard under rights and needs of patients. And this is probably more relevant to the clinical team, but it's worth everyone knowing about it. So some examples of ethical dilemmas, they can be things like patients giving gifts to doctors, patient-practitioner relationship, for example, treating family and friends as patients, or for example, a patient requesting a medical certificate from a practitioner, and a practitioner might not necessarily believe that their condition warrants one. So we talked about musts for this indicator. So for this indicator, there must be evidence that the ethical dilemma has been documented, including the outcome or the solution. So a useful approach here is to provide an opportunity for the clinical team to actually discuss the ethical dilemmas. And a good way to do this is you can have it as a standing agenda item. A policy outlining how the team could manage ethical dilemmas would also be useful. And the main idea around here is to provide an opportunity to actually discuss what your system is for dealing with ethical dilemmas. And you could also have an ethical dilemma on a risk register as well. So if we move on to the core standard 3, so that's the practice governance and management. Practices must, so this is another one of those musts, plan and set business goals. So how you and your team would like to do that is actually up to you. So there are some really good templates available, but before referring to these, it's actually a really good time to meet with your team, confirm things like your ethics and your values. Perhaps you'd like to develop a code of conduct, or you might want to refine or revisit your values statement. And this could be displayed in your waiting room or on your website, or also internally in your staff room or other team platforms. And the key here is really to use this indicator as an opportunity to get together and establish what the key focus areas are, and then have a plan to get there. There's actually another indicator attached to this one, but this is one of those that has that triangle. It doesn't have the triangle next to it, so it's not flagged. But it relates to actually evaluating your progress around the goals. So even though it's aspirational, it's also a good opportunity to think about how your team will review your goals. And so you can use tools like SMART goals and action plans, and there are lots of business plate templates available. So if we're moving next to business risk management, that's 3.1C. This is an area that relies on an open culture around risk, acknowledging that safety and risk is actually part of quality assurance, and it's also a key part of practice management, which I'm sure you're all aware. So having a business risk management process helps the team be proactive. A risk register with a risk matrix can be very useful here, and this is where you have the likelihood of the event and the severity of the impact recorded. And this will provide information on the appropriate course of action. So central again to this is a no blame culture. And this basically involves the whole practice team, so that it actually becomes everyone's responsibility. And again, we talked about meeting agenda items. Risk management is a standard one that is another good option to include if you don't already have it. And depending on the size of your practice, it may be useful to have a risk management team that regularly meets to review risks. And the other important thing around risks and identifying them is it does provide some training opportunities that may arise, and it can be a great way to meet some gaps in process. So now we can have a look at the last two under core standard 6, information management. So it's actually a requirement to have a policy on use of email. And even if you don't have you choose not to use email, you still need to have a policy around it. So yes, if you don't have an email system set up for patients, you still need to have a policy that states that. And I know this is a particularly relevant one because of COVID. We've all had to pivot the way we deliver care, and so we've had to sort of work remotely and you know, not have that option to sort of hand patients referrals or other such things. So this is actually quite an interesting and timely standard to look at. So the RACGP actually has a really good risk matrix, and it actually outlines low, medium and high, and has some examples of what processes you can have in place to make sure that you are meeting the standards. In terms of some resources, it's useful, or some support. What I've actually found useful is reaching out to your accreditation provider, your indemnity provider when you are writing a policy, if you want to just make sure that it's sort of meeting the standards. And also you could reach out to your IT provider. And what they can do, for example, is set up an auto reply so that if you do have an email address and it is on your website and patients send an email, it really helps to outline what the rules of engagement are for your practice. So for example, it might be that you let patients know that we're not going to communicate medical information via email, or that direct them to ring the clinic, and also that they can expect a response within 48 hours. So if a patient does request email correspondence, they need to be made aware of the risks associated with communicating via unencrypted means. And patients also need to provide their consent, and it's a good idea to actually record that consent. And you can certainly do this on your new patient information and privacy consent form. That's a good way to sort of capture that as well. But each and every time they would need to confirm their consent, and the doctor will document it in the file. There are options to send email via encryption. And before you do that, obviously you need to make sure that the email address you're sending it to has been verified. And these are all in the RACGP matrix that I mentioned before. But I guess before you even move down that space, it's a really good opportunity to talk to the rest of the practice team and work out what your process will be. And then you can follow the guidelines and get a process in place. And just finally, the social media is another area, and it's important for your practice team to be aware of what your social media policy is. And the requirements here are also closely linked to AHPRA's social media policy. And the RACGP do actually have a really good social media guide. And another thing I'll make a comment on around social media is having that policy and using that as an opportunity to remind your staff once a year. So it can be an annual thing, and also as part of induction. So we looked at some of the general practice new criteria. I'll just run through now the one of the new ones for quality improvement, and then the last two for general practice. So remembering, of course, accreditation is all about quality improvement. This next indicator is from the quality improvement module, and it relates to how your practice seeks feedback from the team about QI systems and how effective these systems are. So lots of clinics like to keep a list of their QI activities. Often they tend to revisit their improvements around the accreditation time, and they're very surprised at how many changes and improvements have taken place when they look back since their last accreditation cycle. So these improvements can be displayed on notice boards, in team meetings. So again, I'll talk about another standard agenda item is actually having quality improvement. And you can also share improvements electronically with the team as a way of celebrating and acknowledging all the great things that your practice is doing. To help the team engage in quality improvement as part of their day-to-day practice, quality improvement doesn't have to be viewed as a significant change or the purchase of an expensive piece of equipment. Often it can be something that might seem insignificant, but it can actually have quite a big impact on outcome. And it could be something simple like a tweak to a process, like how appointments are scheduled or how patient complaints are handled. Leading a team through the quality improvement journey is really about creating a culture of ongoing learning and development. Allocating a person who has a primary responsibility for driving the quality improvement process will allow for accountability and get the team motivated to take part in the process. You may like to employ other methods of seeking feedback from the team. So some other ways I've used this is an anonymous survey, if you think that might encourage more transparent feedback. And finally, the new indicator there in the general practice model, it relates to the requirement for the clinical team to be trained to use the practice equipment that they need to perform their role, and also for them to be aware of the risks involved. So what might be useful here, a way of doing that is if you've already got a list of the equipment that's in the practice via your equipment maintenance schedule, you might want to just tweak that template and turn it into a bit of a checklist and add a space for the patient, for the doctor's name or the clinical staff member's name, the date, the site, and all that sort of thing. And you can use that as a checkbox for the clinical team members to acknowledge that they're aware of the training. There's, of course, providing them with the training, but that's the evidence, just ticking that off. And it's also, I guess, a useful way for an induction process. So when there is a new nurse, a new doctor, new registrar, you can use that checklist as well. So just next slide, please. So if we're having a look at accreditation day and beyond, notwithstanding, it's completely normal to feel worried or stressed in the lead up to the event. I can relate just prior to this webinar, feeling a bit nervy, particularly one where you're also being assessed. I'd like to actually reassure everyone that the approach to accreditation is a journey of ongoing learning and development. And I know that sounds very cliche, but if you actually look at it that way, as part of that mindset, it will hopefully remove any unwarranted pressure around whether you're actually going to be passing or failing. Surveyors are actually trained to seek out evidence and examples where practices are meeting the standards. And the beauty of the 5th edition standards is that there are many ways practices can meet the standards. And so if you focus on the intent behind the standard and the outcomes you're hoping to achieve, the process becomes more meaningful. And of course, the best way to do this is to do this as a practice team. So a collaborative approach will actually assist in this process. So engaging with your team to identify and actually seek volunteers from each practice area to drive the journey and then come together to work through the process is a really good idea. There is a requirement for several RACGP indicators to have a policy. So there are some documents and in terms of meeting compliance. But it's also good practice to have a system for documenting and storing data from a quality assurance and risk management point of view. So you can see there on the slide, doctors' documentation, so their registration qualifications, CPR, CPD, of course, the same for nurses around the CPR and CPD and CPR for staff, immunisation status, that should be recorded. Training, so recording, all of the training doesn't have to be just external. A lot of really valuable training can actually get delivered in-house. And so you can come up with your own templates around that and certificates, and then just store those, and staff induction as well. And finally, we can actually exhale, because after all of the efforts of all of those in your team, including the patients. So the patients are actually engaged as part of the process to provide patient feedback. It's an opportunity to exhale, celebrate all of the hard work that you've all put in, and also embrace the challenge to maintain that great momentum that you've all built up during that process, and by incorporating the quality improvement measures into your day-to-day practice. So I'd like to wish you all the very best of luck. Thank you very much, Maya.
Thank you, Laura. Thank you for that overview and those lovely tips and tricks that you've given us. Now we will move to Carmel's presentation and her experiences around accreditation. For those of you who don't know Carmel Brown, I'd say that there'll be very few. Carmel is a leading figure in practice management, and she undertook the first accreditation visit of a general practice in Australia. She's a fellow of the Australian Association of Practice Managers, AAPM, and a former long-term committee member. Thank you very much for giving your time to us today, Carmel. Over to you.
Thanks very much, Maya. Much appreciated. I thought I'd first start to say that I was a surveyor right back at the start of accreditation, and I was very comfortable with the role. But I must say that when our own practice had to be accredited, it was always a daunting experience for all of us. I've been through many cycles of accreditation now. In the last 3, I have used the PracticeHub for the documentation that was involved. And I must say, each time I passed the accreditation with no recommendations. There's a lot of support out there, we can all know that, such as the RACGP, all the different accreditation agencies, and the PracticeHub, of course. Despite all this, I find accreditation a challenge, on top of all the day-to-day issues that I know we all have to face. So when I'm thinking about today, I thought there are 2 main tips that I'd like to give you. Accreditation is a process, so it's not an event. Don't wait till the year that accreditation has to be done. Just use your manual, I use the hub, every week, every day, to just log things so that we don't have to start deciding at the end, close to the accreditation date, what did we do? How did we do it? These things can be done and really simply put into a manual like the hub, and it just makes life, when accreditation comes, much more comfortable for us all. With the core modules under the 5th standards, and that's I think quite a big jump from 4 to 5. The more generic core modules, the ethical dilemmas, the risk management, I actually put little tags around so I can just prompt myself to remember, because I actually face these sort of issues every week. But they just slide through, everything else goes on, and you don't actually remember how you've actually dealt or what you've actually put in place over the time of the accreditation process. I also, even in our meetings, I'll put little tags so that I can remember, let's talk about this. Has anyone in the practice had an issue that I'd like to, and then keep a log of this in the hub or whichever documentation you use. Discussing, the important thing for me is that in the early days, I think the manager tried to sort of hold it all together. By the time we've come to 2020, involve everybody. It's too big a process now. Engage the staff, talk to the doctors about it. Whatever systems you use, delegate it out. For instance, in my case, I use the PracticeHub. I've got our nurses on board. They can actually look at what's required. They have their own reminders in. And they come, and when we have our meetings, we discuss how far along the process we've got. The doctors, doctors are so busy, we all know that. And I actually think they have a lot of ethical dilemmas that they don't even regard as an ethical dilemma. But there were some great examples in the PracticeHub to start the conversation with them. Mature minors, we're getting more and more young patients coming in wanting their own appointments. They're actually under the age of 18. So there's a whole, and all this I think the doctors deal with. So I'm asking them now in our general chats, have you got anything that, and then I pop it into the PracticeHub for myself. The nurses, familiarise your nurses with the treatment room protocols. And part of what's required in the 5th, is there any sort of risk involved in what they use? I've asked them any issues that they have like that, come back to me, we'll put it in the hub. And therefore, when it comes to the accreditation date, you've actually got a lot of information all sitting there that you can maybe not remember if you haven't kept a record. I regard our reception front counter as the coalface. They often have great suggestions to improve the process. They're actually out there all the time. Any feedback, I'm now logging in the manual, in the PracticeHub, and if it's realistic and I want to put it into place, come back and ascertain its performance and the outcome. Again, it's just using the hub or whatever you use on a daily basis. It's really important. So with all these, we have great discussions about these topics. Go and put it in and record it against the accreditation criteria, please. Make a note in your PracticeHub about any risks that are going on. There's actually great templates sitting there, so it's really not that difficult if you just log in and just keep a list. We all fail in this, especially in the years after you've finished your accreditation. You think, phew, I've done it. But then suddenly the 3 or 4 years turns up again, in our case 4. And we have to sort of keep going with it all. So the hub, if I use in my case the hub, I'm happy to put it in straight away, and then I've always got an event going on that I can keep an eye on and see what the outcomes are. With all new staff, I've been very fortunate because the hub has great learning modules. Um, for educating new staff, they are actually asked to be able to log in, look at patient records, the way we do it, the criteria, what's recognised now as a standard, privacy, appointment management, all this. And once they've looked at it, I can actually go and track it so that I know that they've actually read what our practice requires and what's required by accreditation. This is just part of the upskilling process from our point of view, in terms especially for front desk staff who really often come in and have no education at all. The other great thing that I find, and they're asking us to have policies on email, social media, and this is really important in today's world, I feel. We're now able to have a policy, and the way the hub works is that we are actually ask them to sign in, read the policy, and if they agree, sign off on it. And that it's dated so that if there's an issue in a year or so with any of these things, then I'm able to go back and show them that you've actually signed off on this. It's a great backup to us at the same time. So I just think these are all really important issues in terms of tracking what's going on in the practice over the 3 years. And then we don't have to rack our brains at the end of 3 years and try to remember what we did and how well we've done it over the time. I actually link, the forms we have and templates to the policy and procedures in the practice. I've got things like the pop guns, strive for 5. These are really important, and they just sit there. By using the hub, these are educating the front desk staff on how to understand what goes on and why we do things, especially pop guns, because they are the triage at the front counter is so essential. So we use the practice and procedure compliance function, and this is part of proving in the accreditation visit that we're actually really compliant with the whole process of learning and upskilling, and that basically improving the quality of the practice overall over the last few years. So it creates such a good audit trail to demonstrate to the surveyors the quality improvements and undertaken and the team engagement, because really the 5th standard seems to be to me mostly about team engagement. Everyone has to have part of it, and also everyone's got a very important part to play in this whole process. Our staff have been really great with that. They've become engaged in it. They actually, the little tests that they have to do to prove that they understand things like the privacy, has been really interesting, because a lot of these people have no idea when they started how important this sort of information is. Prepare. So I've discussed that. I've discussed when my colleague and I looked at the accreditation, what has to be done in the pre-accreditation portal. We then got the Practice Hub side by side and kept linking pages back to make sure that what we had documentation-wise matched what was required by accreditation. We added hyperlinks, I think, to the relevant practice and procedure pages, and Anna Marie is going to demonstrate how that happens. In actual fact, it doesn't take that long. And what I found was, when I was doing it, if there's anything I had missed, especially with the new standards or the new modules, we created a list so that I was able to go back on the daily basis and just update that, keep in mind what I didn't have in. I've got another year now, thanks to COVID, for accreditation. So I've got a year to sort of to finish it, to create it and get it through. When the assessor logs in, I think most of the surveyors these days know about the Practice Hub. My surveyors over the last 3 visits certainly knew it. I created a login for the assessor, And that was a huge help to them, because often they used to look at all the documentation that was required prior to the visit, and that enabled them to have a faster visit, do the other sort of stuff that they need to have the interviews, look at the treatment room. So from that point of view, I really recommend something that they can actually have a look at well before they come. We're not fishing around trying to find information. It will all be there. On the day, log the assessor into the PracticeHub. There's a great tip for the surveyors in the hub. Open the tip sheet, they'll meet, and a lot of them will know what to do with this, but it's great if someone hasn't used it before. And then show them the search function, which I absolutely love in the PracticeHub. If there's anything they think's missing, they can actually find it through that. Then I leave them to it. I hope they'll be out there in a couple of hours, and then celebrate when it's all finished. So thanks very much, everyone.
Thank you so much, Carmel. And thank you for that insight. And I did forget to mention that Carmel, together with Anna Maria, actually developed PracticeHub before they became part of Avant. So these two ladies truly are the experts in using PracticeHub for accreditation. And to that effect, we now will have Anna Maria show you PracticeHub and exactly how it works. And she'll certainly attempt to answer some of the questions that have come through on the chat. And thank you very much for such a great range of questions. Just a little bit about Anna Maria. So she is our Senior Product Manager, and she has a background in business and in practice management, including developing PracticeHub itself, but also having worked in divisions of general practice for quite a long time. Over to you, Anna Maria.
Fantastic. Thanks, Maya. Just confirming I'm not on mute. There we go. And thanks to Carmel and Laura as well before me. There's a number of questions I can see coming through about PracticeHub. I'm going to try and cover off some of them as I'm doing the demonstration, but hopefully one of my other panelists will keep track of what I don't cover off, and we'll revert back to those at the end of the demonstration. All right, so the demonstration today is really focused on how PracticeHub supports your accreditation process. It's an easy way for you to create, manage and demonstrate the systems that you've developed for your practice. So what you're seeing on your screen at the moment is, I tend to think of that this is the systems in action on the dashboard. So things that you're seeing is your alerts and tasks, so things that you personally in your role or individually are responsible for can action. And separately, you can see what the people in your team need to be doing and what you're monitoring. So Carmel mentioned about policies to be signed off, that sort of thing. So in this instance, I can see I've got some new starters, some new policies that need to be signed off by other members of my team, and I can keep track of those and follow them up with them as well. All right, so the first thing I'm going to talk mainly about is the manual, the policy and procedures, because I feel this is the core of the whole product. So here we are in the policy and procedures manual. And so the first thing I want to highlight to you is that if you, when you get PracticeHub, if you get it with the templates, the general practice templates are all aligned with the standards. So as Laura mentioned, the 8 core standards, the 3 QI standards, and the 6 GP standards. And that means that essentially these are your category headings, and under each of those, you've got the relevant policies and procedures for that particular standard as well. The other things that you can see in here, for example, in my expanded view, we've got things like in rights and needs of patients, excuse me, presence of a third party, management of patients refusing treatment, and ethical dilemmas. The other thing that you can see is we also have here our frequency of when or how often we're going to review these policies and procedures. So setting up a review schedule is another way of you being able to demonstrate the system that you've set in place as well. So in addition, when it comes to accreditation, Each page that relates to a standard can have a link to that relevant standard. And that's really helpful when you go through afterwards or when you're preparing for accreditation, because you can filter your contents list to see the pages that have relevant policies or are relevant to the standards. So having a look, for example, at the page here for ethical dilemmas, we can see we've got our policy and procedure here. We can see, in fact, that we're asking our team to sign off on this every year automatically, whether it's changed or not. And we can also flag which particular roles. So we're very much about consistency and, again, creating that system. So we can see which roles need to sign off on that policy and procedure as well as seeing the standard that it relates to. Now, if you're thinking this looks quite busy, bear in mind this is what the administrator sees. So they're doing the setup, they have the editing function, and again, you have that ability to say who can edit and who can't. For a normal user, their view of the page is much simpler. So basically, they're going to see the policy and procedure, they'll see the accreditation link, and they'll also see this compliance note that they're required to read this as part of their induction or compliance. And down the very bottom, the person's name, have read and understood and agree to comply, and they can just click on confirm. And now you have an auditable trail to the policy and to their compliance. In addition, as both Carmel and Laura said, a big part of the 5th edition of the standards is engaging the team. It's just so important. And one of the simple ways to do that is for your team to be able to add a contribution. So if they see something in a policy or something in the practice, they can simply click on this and it will send you as the administrator their thoughts, their message. So it doesn't mean, it means they don't have to do a post-it note. They don't have to do any other sort of, trying to remember to catch you. And this is really useful when you've got a lot of part-time and casual staff as well. So very handy indeed. Now I see we had a question there relating to how do I see which policies have been signed off. So let me just quickly show you that. So over here in our compliance section, I just go to my archived and we'll just switch it to all of them. And here you can clearly see the date, the user, the page that was signed off, and whether it's that sign off is still current, which if it is, it's got a tick. If it's been superseded by a new version, then it'll have a cross, and that means you're probably waiting on that person to sign off on the new version as well. If you want to narrow down, you can also filter by individual policies. And I know, say, for example, for accreditation, if you wanted to look at privacy policies, you could just basically sort through anything relating to privacy. Apparently not on this one, but you can certainly filter through those as well. All right, other things to highlight for you in the Policy and Procedures Manual. Okay. So other things that are really useful in terms of documentation, which both Carmel and Laura talked about, is things like your registers. So you can easily create simple registers in PracticeHub for things like your risk, incidents and compliance breaches, complaints, quality improvement, and so on. And again, as we mentioned, it's so simple. You're probably already noting these down somewhere. It's the same amount of effort, but it's just a matter of doing them in here. So you can simply add things in that, we had a slip on the wet floor. So the relevant standard process for change might be to, you're going to investigate and get some, mats, et cetera, et cetera. So really, really simple to add this information and keep that running list of what you're doing in your practice, things that you are regularly doing or that are regularly occurring for you. So other things that, again, come accreditation time, all this information is in there and really simple for you to retrieve and for your surveyors to view as well. The other thing that you can also do in the manual, which makes life a lot easier for everyone, is you can go through and set up a category for your personnel. And this is particularly useful, I think, for your healthcare practitioners, as you've got a lot of documentation, but even for the whole team. So for example, we've got our doctors page here. And the things that we've done, we've incorporated a hyperlink to the doctor's APRA registration number. And over on our review date, we've put September in. So 30th of September is the review date for medical practitioners for their registration renewal, May for nurses, November for dental, etc. So it will give you that reminder that it's time to go in, check that they have renewed their registration, click on the link, confirm that it's been done, roll the date forward, set and forget till next year. The other thing that you can do that's very helpful is you can attach any relevant documentation. So as a surveyor, I'm suspecting that Laura will be looking for CPR and CPD and immunisation status, and she can clearly go in and have a look in here and find that information that's been attached for that particular doctor, and do the same for all the other practitioners as well. The other point that was made earlier during the presentation was the importance of logging in-house training, which is really valuable as well. And again, I would set up a simple table in here, the date of the training, the subject, a bit more of a description, who attended, who was the provider, the duration, and so on. So again, as you do these things, you can easily log that information, and you're not going back at accreditation time when you're preparing thinking, I'm sure we did this stuff, but does anybody remember who was there and what it covered? You've already got that listed in there already. We've talked, and a few of you have raised some questions about the training modules, so I will give you a quick look at those. The topics that they cover are what we consider to be the most, I think, most likely to have risk involved, I guess, things like, you know, the transfer of patient records, privacy, those sorts of things. So these 8 learning modules are already built in. And for me, they're a way of giving evidence, of backing up that read and understood compliance component with evidence that people really did understand. Because once they've done the module, they need to do the quiz, they need to pass the quiz, and then you have that peace of mind that you've got evidence that when they said they'd read and understood, they really had done so. We do update these regularly. At this stage, I don't believe we're going to add additional ones, but we will be updating the current ones later this year, so that come the new year, you'll be able to roll them out to your team. I think they're terrific for new starters, which is, I believe Carmel does that with her team. But then annually, just to get people to do the refresher. It doesn't take a terribly long time to do them. But again, I think it's important to highlight these things because they are so important. When they go wrong, they go badly wrong as well. So those are the training modules. So another part around documentation, of course, is around things like equipment. So the equipment register in PracticeHub is sort of a combination of an asset register, a reminder scheduler, and a document storage facility all in one place. So in my example here, we've got our sterilizer, and we can see information around the serial number, you know, the type of ownership. But most importantly, we can demonstrate that we have a process for maintaining the equipment. We've got a system in place with reminders, and when the work is actually completed, we can upload and attach the documentation. So again, your assessor will come in and they'll be able to go, okay, I can see 2019, I can see 2020. They can see the progressive information as you've from the 3-year cycle since they were last there. Looking very similar is the contracts register. So again, things like your waste management, after hours care agreements that you have, keeping all of these in here makes it really simple for you to remember to locate this information, but also for your surveyors as well. So for me, it's really around creating this kind of information ecosystem that they can go through. All right, so I'm going to give you a couple of quick tips, and Carmel has alluded to them as well. So Pretend this is kind of the portal of an accrediting organisation. There are, I think, 4 or 5 of them out there now, so they all look slightly different. But as we mentioned, you know, one of the things I like to do, and certainly I think works really well, is if you have dual monitors, put your PracticeHub site up on one, open the portal on the other side, work through the various criterion, and as you do that, you can simply add in the various website addresses or URLs for each of them. So if I get to the criterion about ethical dilemmas, I will just put in the URL for that particular page. It makes it so much easier for the accreditors because it means that once they've logged in, they can just go through their portal, click on the link, and it will automatically open the page. But also for you as you work through, it's a much smoother process as well. Okay. The other thing, as Carmel mentioned, a to-do list is really easy to do in this. We find one of the things that I think works really well is if you're working through and you find a page and you go, I still need to actually do a bit more on that, use the file name or the page name and use some initials like TBC, to be completed, pop those in there, save that. And by the time you've worked through all the criterion through the portal and you've done that wherever it's relevant, just quickly save that. It means when you're ready to go back and go, okay, now I want to go in and fill up those gaps, I can just search TBC and up will come the results. And you can see, there we go, that's the one in there. When I go into that page, I update the information, I'll remove the TBC. But it's a really simple way. It's certainly better than jotting down notes in notebooks and making lists in separate Word documents, all those sorts of things that people do. That is certainly one of the tips for you on that as well. The other thing that we have mentioned is this Surveyor cheat sheet. And so what I would highlight to you in your practices is it shouldn't be considered a complete list of the documents that the surveyors would be reviewing, but it certainly gives them more of a sense of how to navigate their way around the system. And particularly it highlights things like the global search function and the in-app search tools as well. So, you know, as we said, sit them down, log them in, show them the cheat sheet, give them a bit of an orientation to the platform, get them that cup of tea and a muffin or a Tim Tam, and set them on their way, and they should be able to easily navigate their way through the information. All right, so that brings me to the end of my very brisk demonstration. If there are any questions that we can answer, that any of the panelists can answer, please feel free to add them to the chat. Just to go through some of these questions, there is a question around, do all staff have access to PracticeHub? Ideally, yes, because particularly around the compliance function, if you want to do the I, Anna Maria, have read and understood and agree to comply, then each person needs their own individual user profile in there so that you have that ability to track that compliance for assigning learning modules and that sort of thing. So to use this most effectively, I think the answer is yes, you do need to have all staff having access. But also, as you saw, there is the ability, and I think that was an earlier question, you can certainly lock down who has access to edit content and who can't, who's just viewing it. And even in terms of what they can view, you can limit that as well. So there's a lot of ability to structure what information is accessible to which users. Maya, would you like me to hand back to you for the, if there are no more questions, maybe our next steps?
Yes, thank you, Anna Maria. There was just a question for Laura around, do we still need a hard copy of APRA, or is the link sufficient when on the day of the survey, of the visit?
Up and provide the information that you need. So I understand that would suffice.
Mm-hmm.
Thank you. Anna Maria, I've had lots of questions around how do people actually get to PracticeHub. So if you would flick over to the next slide, please. So obviously for those who haven't had the pleasure of using PracticeHub yet, please do visit our website and you can find out about all the benefits and features, certainly in a lot more detail. We have some videos there as well. And you can book me or my team to give you a demo, a detailed one-on-one demo, also online. And we certainly show you all of the PracticeHub in more detail. We've got our phone number there. The email is info@practicehub.com.au, and of course our website practicehub.com.au. For those of you who are clients of PracticeHub and would like a little bit more support with accreditation, please do contact our support team to find out how we can help you prepare for accreditation, including our new accreditation support package. And I'll just hand you over to Persephone now, who will give you a bit more information around what happens after this webinar.
Thank you so much to all the panel and all the audience members that have joined us today. That was a really great session and I hope everyone got something out of it. I know that there's been quite a few questions around, will there be access to the slides, to the recording? There absolutely will be. We'll be sending this out to everyone who's registered early next week. So look out for that in your inboxes. Please contact us for more information in terms of anything that you've seen here around the demo, or if you had any other questions for our panel, we'd be more than happy to answer those if you just email us at info@practicehub.com.au. And in terms of new webinars, we do have more webinars coming as the year kind of progresses. So please look back and be aware of those and attend those as well. And the one last thing is we'd love your feedback on how you felt this webinar went, if there's things that we can do to improve or topics that you'd like to see in future. We are really open to that information. So please complete the survey that's available at the end of this webinar. But thank you so much everyone for coming. Thank you so much to our panelists. You were fabulous and I'm sure everyone got something out of it. So have a good afternoon, everyone.